there! Welcome to the first part of our lesson. This is Emma Patel from YouTube Nurse Channel. We're about to dive into one of the world's most important resources, from the English for Careers Nursing series. Before we start Unit 1, let me explain the structure. This book has 15 lessons, and after Lesson 8, there are several readings to help us review what we've learned and pick up new words. At the beginning of each lesson, we give you a preview of what you'll be learning. In this lesson, we're going to hospital jobs, describing what people in a hospital do, describing routines and current activities, the nursing profession. This book is here to help you get familiar with the specialized words used in the hospital environment. Have you heard the term scrub up in a hospital? It means washing your hands up to the elbows before surgery, which is different from regular hand washing. So, why does every lesson start with a scrub up? Just like in a hospital, the book wants to remind you to always be prepared. Washing your hands is about getting ready to perform the procedure. And here, each lesson's scrub up is a warm-up to start learning. So wash your hands, get ready, and let's dive into Lesson 1 together. Scrub up. Work with a partner to match each job with the person in the picture. If you've downloaded the book, you can see a picture included in your book. I shared a part of that picture in the previous slide. In the picture, you'll see different people from various occupations doing their thing. Our task is to match the names of these occupations with the numbers above their heads. For example, the first part is already done. Anesthetics is number 13. I've arranged the jobs for you now. Before we move to the next slide, here's a piece of advice. For each exercise we do, feel free to pause the video as much as you need. Work on the exercise at your own pace, and then continue watching the rest of the video. Let's make the most of our learning time together. Match each phonetic spelling to 1PF the jobs. Try to say them with your partner.
Unit 1. Scrub up. 1.
Scrub nurse.
2.
Cardiologist.
3.
Receptionist.
4.
Surgeon.
5.
Physiotherapist.
6.
Radiologist.
7.
Consultant.
8.
Anaesthetist.
Since this book is from Oxford, it's British. You have the option to choose either British or American accents from the dictionary and practice with your partner. For guidance in the dictionary, check out the first pages. They fully explain how to pronounce the signs you see. I'll go through them one by one, and I'd like you to repeat after me. A. Scrub nurse. B. Receptionist. C. Surgeon. D. Physiotherapist. E. Radiologist. F. Consultant. G. Anesthetist. H. Pediatrician. Before we dive into the listening exercise, I want to give you a heads up. This listening was made for a different edition of the book. While the book has been updated, the listening has not, which means 2 of the words in this recording are added. So don't get confused. Just listen closely and try to identify the words. Remember, 2 of the words are extras. Stay tuned and let's get started.
Unit 1. Listening 1. An admission. 1.
Can you hear me? Mrs. Benson?
Yes. Where am I? What happened?
You're in my ambulance. You've had a fall and we're taking you to hospital.
Yes. Now I remember.
All right, we listened together. Now, the book has raised an interesting question. How is stress marked in phonetic spelling? Take note, in the term scrub nurse, there's an apostrophe before the S. This apostrophe indicates the stress of the word. It shows the part that you should emphasize with more stress, concentration, and pressure. Now, I've assigned numbers to these words. For instance, scrub nurse is number 9. Go ahead and match these with the numbers you wrote down earlier. In English words and phonetics, an apostrophe shows where the stress falls. When you see a small apostrophe under syllabic words, it indicates a bit less stress. If the apostrophe is placed above the syllable, it marks the main stress point. So remember to focus on the apostrophe that appears above and before the syllable. For example, take note of the word consultant. The first syllable is read lighter, while the second part is read stronger. These are examples of word stress that help you pronounce words more like native speakers. Let's go to the next slide. Listening 1. An admission. Mrs. Benson is admitted to hospital. Listen to the 5 short conversations and decide who is speaking to her in each one. Write 1-5. In the British nursing system, a sister is the same as a nurse. It's a specific classification within nursing. Understanding these terms can help you communicate more effectively in a medical setting. Let's get familiar with these classifications together.
2.
Right, Mrs. Benson, we're going to have a closer look at your heart. Have you had an X-ray before?
Yes. I broke my leg once.
3.
Hello, Mrs. Benson. How do you feel?
Terrible. I've got a terrible headache. And I need to use the toilet.
Okay, I'll draw the curtains and you can use a bedpan. Dr. Bright is coming to have a look at you in a moment.
4.
Mrs. Benson, we've been worried about you, but I've got good news. The X-ray shows your heart is clear, and Sister says your blood pressure is back to normal. How are you feeling?
I feel fine now.
Good. I'm going to prescribe some medicine, and I'm discharging you.
5.
Right, Mrs. Benson. So you want to make an outpatient's appointment for next week?
Yes, please.
Thursday at 4?
Fine.
Good. Next Thursday at 4 o'clock to see Dr. Lee in outpatients.
We listened to the recording together, and now it's time to check the answers with me. I recommend using the listening script at the end of your book. Here's how you can get the most out of it. 1. Listen to the recording once while following along with the script. 2. Read through the script on its own. 3. Play the recording again, this time checking it against the script. 4. Finally, listen to the recording a third time without the script. This practice will help you become more familiar with the terms, accents, and other nuances. Over time, you'll find it easier to understand and recognize these elements, improving your listening skills. In each listening exercise, you'll come across a series of new words. I encourage you to read through the script and identify these new terms on your own. For example, words like outpatient appointment or curtains. Grab these words from the script, learn their spelling, and look up their meanings in the dictionary. This will help you expand your vocabulary and get comfortable with new terms. Listen again and decide if these sentences are true or false. Let's listen one more time to really grasp the details and reinforce our understanding. If you've participated in international exams, you know that they give you a short time before each listening session to check the questions. Let's use that time wisely and read the questions together first. This way, you'll be better prepared and can focus on the details while listening. 1. Mrs. Benson has had a fall. 2. This is not Mrs. Benson's first X-ray. 3. Mrs. Benson can't find the toilet. 4. She has a heart problem. 5. The consultant sends her home. Mrs. Benson's appointment is next week. We listened to the recording together, and now it's time to check the answers with me. Number 1, it is true. Yes, the ambulance will inform her that you had a fall. Number 2, it's true because she says, "Once I broke my foot." Let's keep going and check more answers together. Number 3, this statement is false. Mrs. Benson tells the nurse that she needs to use the toilet, and the nurse responds that she can use the bedpan. Number 4, this statement is false. The consultant stated to her, "Your heart is clear." Number 5, this statement is true. The cardiologist is telling her, "I'm discharging you." Number 6, this statement is true. The receptionist is telling her, "Your appointment is next Thursday." Now let's move on to vocabulary. Verbs for describing jobs. We'll dive into some key terms and phrases, ensuring you understand and can use them confidently. We've learned the different jobs, and now it's time to learn the verbs that describe these jobs. Keep in mind the jobs we covered in the scrub-up session, along with the verbs provided here. Now, let's put these words into the blanks and see how they fit. Complete this description of jobs with the verbs below, and match each one with a job from scrub-up. Number 1 is already completed for you in the book. 1. A pediatrician treats children. Take a few seconds to pause and write down your answers. Once you're ready, we'll go through them together and check how well you did. Two, a midwife attends births and delivers babies. 3. A cardiologist specializes in illness of the heart and blood vessels. 4. A porter moves equipment, furniture, patients, etc. around the hospital. 5. A radiologist takes X-rays and other images. 6. A scrub nurse supports surgeons in the operating theater. Operating theater is a fantastic term to learn. It's widely used in British English. Operating room is also popular, especially in American English. 7. A pharmacist prepares medicines to give to medical staff or patients. 8. A paramedic responds to emergencies and gives first aid. 9. Surgeon performs operations. 10. A lab technician examines samples and tissues under a microscope. Great job! This concludes the lesson. In this section, we've taken an important step toward expanding your professional vocabulary. Each new term brings you closer to mastering English for your nursing career. By mastering the concepts in this part, you're now ready to continue your learning journey in the second part.